that is planned, structured, repetitive, and purposeful, usually aimed at improving or maintaining the physical fitness. This is very, very important for physical activity. It should be a planned activity, a structured activity, it should be a repetitive activity, and it's a purposeful activity. So any body movement produced by the skeletal muscles that results in energy expenditure beyond the resting expenditure, that is physical activity. See the benefits of the exercise. Improves the bone, joint, and muscle health. So no sarcopenia. Now the sarcopenia is a big problem, especially in the elderly individuals, etc. Okay. See, in exercise, it improves the bone health, joint health, and also the muscle health. Improves the circulation. You all know that it improves the cardiac health also, exercise. It promotes social interaction and integration. So you will make very good friends when you are moving outside for the parks, etc., for the physical activity. And it reduces the stress, anxiety, and the depression. So it also it relieves your stress and walking. It improves the functional capacity. So it increases your functional capacity. And finally, it reduces the weight. See the beautiful benefits of the exercise. So in a single word, it reduces the blood sugar, reduces the blood pressure, reduces the lipids, and gives good health, bony health, vascular health, and also cardiac health, and also muscle health. Okay. And finally, and gives a shape to your body, and your self-esteem also will be increased with a good physical activity. Increases the energy expenditure and promotes the weight loss, increases the insulin sensitivity, and may reduce the requirement of the insulin or the oral hypoglycemic drug. Same like medical nutrition therapy. So when you are in good exercise program, say 60 minutes exercise or 90 minutes exercise a day, and definitely it can reduce your OHS and also can reduce the insulin dosages. All the OHS and the insulin acts well, acts better in the presence of the physical activity. Those people on good physical activity. So what on physical activity, what happens? Your glucose will goes to your muscle. Your glucose will goes to your adipose tissue, and your liver will produce more and more glucose output. So there is no place for your fat deposition there. So no fatty liver when you are in good physical activity. So these are all advantages. No abdominal adiposity, no brown adipose tissue or white adipose tissue, etc. So these are all advantages of your exercise program. Insulin production also. Good. Insulin sensitivity also will increase. So it increases the insulin sensitivity and may reduce the requirement of the insulin or the oral hypoglycemia. That means it reduces the insulin resistance, improves the sensitivity, and reduces the resistance. Lowers the blood glucose levels only in the presence of adequate amounts of the insulin. Lowers the arterial pressure. A mild and moderate intermittent claudication may be beneficial. So peripheral arterial disease and good exercise program that also reduces your intermittent claudication and reduces the triglycerides, LDL, and increases the HDL. So unfortunately, most of the Indians are having the low HDL, which is a very, very good for our atherosclerotic production. But your exercise will improve your HDL. And other thing is, alcohol can increase the HDL. But we don't advise alcohol to increase your HDL. But definitely, we can advise the physical activity to increase HDL activity. Improves the exercise tolerance, increases the myocardial vascularity, and improves the cardiac efficiency in general. So they are all advantages of the exercise program. Here a male 60 years, a diabetes of 25 years, also hypertensive and dyslipidemia. So he has thus far led a sedentary lifestyle. So he had diabetes, had hypertension, had dyslipidemia, age 60 years, and already the diabetic life is 25 years. He has read about the benefits of exercise in diabetes and wants to start a regular exercise program. He wants to start after 25 years of the diabetic life at the age of 60 years. So what advice will you give him regarding the exercise? First, get the TMT. Okay. First, get the TMT, exercise tolerance. Otherwise, if the patient goes on the physical activity or joins in the gym, so he will die with myocardial infarction or sudden cardiac deaths. So any age group, more than 40 years of the age group, a diabetic individual wants to start in an exercise program, Before that, you please get the TMT, please get the 2D echo and see whether the patient is fit for the physical activity program or not. Then only you advise the physical activity. Even the simple walking. Videos also. They are going to getting cardiac. Yeah, yeah. Yeah, yeah. Yeah, yeah. Yeah. Post-COVID, very common, atherosclerosis, thrombotic attacks. Some cinema actors also they died while doing on the exercise program. Before initiating an exercise program, routine exercise stress testing is not indicated prior to the initial exercise program in asymptomatic individuals. But a simple walking for 10 minutes, 20 minutes not required. But we are walking when we are doing for the exercises or resistant exercises, etc. You need TMT. Providers should perform a careful history, assess the cardiovascular risk factors, aware of the atypical presentation of the coronary artery disease in patients with the diabetes. High risk patients should be encouraged to start with short periods of low intensity exercise and slowly increase the intensity and duration as tolerated. So should not allow them to go for 60 minutes walk or 90 minutes walk on the day one. Always start with 15 minutes or 20 minutes and every 4 days or once in a week. So there should be increment in about 5 minutes or 10 minutes and slowly you can reach the 40 minutes walk or one hour a week in a span of about 15 to 1 month, 15 days to 1 month. And diabetes complications and exercise. Suppose if it has the proliferative retinopathy, okay, acceptable activity, low impact cardiovascular stress, swimming and walking. So what are the contraindicated exercise for proliferative retinopathy? High impact activity, weightlifting, jogging. So what happens weightlifting? So suddenly there will be the retinal detachment. So in proliferative diabetic retinopathy. So in strenuous exercise, they should not do it. A simple exercises, a simple walking or swimming, that is advisable. In nephropathy. So low to moderate intensity activity is okay, but high intensity activity will increase your proteinuria and increases your creatinine levels. So again in nephropathy individuals, so simple walking or low intensity, not high intensity activities. Peripheral neuropathy, swimming is best because the foot is not on the ground. Bicycling also is important, whereas the treadmill is not good for the peripheral neuropathy because the sensations are not intact. Jogging and prolonged walking, so there are all chances of falling and then they injure themselves. Autonomic neuropathy, exercise in extremes of the temperature. So autonomic neuropathy, there will be a sudden hypoglycemia will be there. That is about neuroglucopenic hypoglycemia. So definitely that is always bad when they go for the strenuous exercises. So this is the FIT principle. What is FIT? F is frequency. At least not 5 days a week, 7 days a week. That is the frequency. Intensity, moderate intensity, not the vigorous activities. Type, so aerobic and a little bit of resistance exercises. And time, so 60 minutes a day. So this is a Western population. This advice is for the Western population. For us, first frequencies are for us 7 days a week, and the time is about 60 minutes a day. 60 minutes a day. 60 into 70, so 420 minutes per week. So that is the time where there will be more and more insulin resistance and more deposition of the fat. So these are all the recommendations already I told you. So aerobic exercises, they use oxygen for energy. That is aerobic. Aerobic means use oxygen for energy. Resistance exercises, strength training exercises. See the heart rate maximum. This is very important. What is the maximum heart rate? 220 minus A's. And ideal intensity is 70 to 85% of the maximum rate heart. So whenever a fellow is on the exercise program, for example, a 40-year-old fellow. So what is the maximum heart rate? 220 minus 40. How much? 180. So don't reach that 180. Only 70 to 85% of the heart rate. That is the ideal intensity. That means say 75% of your 180. Yeah. So maybe 150 or 140. So when the heart rate is beyond the 140, that is the time to stop the activities. So this is a very important point to be told to your patient. Whenever the fellows on the diabetics on the exercise program, so the maximum heart rate is 220 minus your ACE. And then don't aim for the 100% of this. Aim for only 70% or 75%. That's all. So examples of the aerobic activity, a brisk walk, running, swimming, cycling. So we always advise our diabetics with a good shoe, especially shoe is very important. Barefoot walking should be avoided. Okay. And chappals walking also avoided. Only shoe. You must be wear a shoe, very good fitting shoe also. So orthopedic shoe. Okay. Yes, yes, preferably. So aerobic activity is a good walking for about 1 hour a day. Running, that's a brisk walk, and swimming and cycling is also advisable. So resistance training, already I told you. Flexibility exercises, hypoglycemic exercise is a very common. Yoga is very good. Yoga has many purposeful benefits. It promotes digestion yoga. It improves blood circulation, builds up concentration and willpower, helping the patient to maintain a weight loss program. So yoga gives you a positive strength in your body, a good concentration and improves your willpower, helping to improve the posture and the flexibility, enabling the patients to be more physically active. So yoga can help you reduce the blood pressure also, contributes to the general sense of well-being, and it may therefore be used in improving the diabetes control. So in fact, yoga, our Indian patent, but unfortunately, so now the yoga has gone to other places other than our India. So in some countries, no, the teachers with the highest income are the yoga teachers, not your maths teacher or biology teacher or your medical teacher or your engineering teacher. Yoga teacher is given very good salary in the foreign countries. So yoga plays a very, very major role because yoga keeps your body in a fit condition. Always good yoga meditation. Good, good, yes. Yoga and meditation is good. Good advice. Good. Patient education in the diabetes. This is also very, very important part. So because education, because it's a lifelong disease, no known cure in most cases. So it's a lifelong disease. Patient has to learn to live with the disease. Okay. Patient has to be an active partner in the management. It is almost like a marriage. Whether you like it or not, you have to live with your better off for your lifetime. Okay, so same thing. So you should learn to live with your better off. Patient has to be an active partner in the management. Okay, hence educating the patient is essential. Okay. See, how can the diabetes education is be imparted? So at each patient visit. See, in every visit, I will sum at least 1 or 2 points about the diabetic education. Okay, at every visit. Suppose the patient comes to me for the 50th time or 60th time, I remember. So I will always tell a new point to him. So this is a new point about your medical education, and you please listen these words, and also you to pass on this message to your friends and your family members. Okay, and then group discussion. Suppose if you are maintaining very good practice, so suppose once in an hour, so you can make all the people outside the our chambers. There are about 5 or 10 diabetic patients will be there. So ask the sister to assemble all the diabetics in that one place, and then that will be the group discussion. Okay, so this lady says that I am having the diabetes for the last 15 years. I had some diabetic foot ulcer, I had some tuberculosis, or I am also a diabetic hypertensive, etc. So that, yeah. So in that way, the other fellows will know that, oh, if I don't control my diabetes well, so definitely I am going to get the pulmonary tuberculosis also. So the group discussion will help a lot. So the group discussion and also the diabetic camps. So there also we can advise in toto. So we'll advise the patients about the diabetes, etc. And of course, your Sukhi Bhava, your papers, Wednesday and every Wednesday in Enadu paper. So they will give some some lectures or some literature on the diabetes and other common diseases, the print media, electronic media, etc. So this is how. Sunday. Oh, very good. Hindu Scientific Edition. So who can impart the education? Anyone in the diabetes care team. So you are going to be a diabetic physicians. So the nurse, sometimes you need to tell all these things to your nurses so that they also will act as a teachers. Podiatrist, there is a foot care, some dietitian, and social worker. So unfortunately in India, you should behave like all in one, all in one. Okay. So every patient encounter should be treated as an educational opportunity. Huh? Never scold any diabetic individuals. Okay. So never scold any diabetic individual. So please listen. Please understand. So you should have a lot of empathy and sympathy towards your diabetic patients. So this is the very important. Okay. So every patient encounter should be treated as an educational opportunity. Components of the diabetic education: information regarding the disorder, what causes it, is it insulin deficiency or is it insulin resistance, what is the role of the muscle, what is the role of the liver, what is the role of the fat, what is the role of the blood pressure, etc. What can be done to prevent it, how to prevent the hyperglycemia. So whatever the role of the diet, what is the role of the exercise, what is the role of yoga, meditation, and what is the role of the regular medication. So these things, weight should be treated. So if the sugars are not under control, what will happen? What will happen to your retina? What will happen to your kidneys, your brain, your heart, etc. What happens if it is not controlled? So that means the complications. Not only your vascular complications, micro and macro, a lot of the infections are also very common in our Indian patients. So UTIs are respiratory tract infections, foreigners gangrenes, carbuncles, okay, fungal infections, tuberculosis. So these are all very common. How can complications be prevented? With a timely investigations of the markers of the preventions, complications, like your microalbuminuria or your ECG or your echo, etc. So information regarding the treatment, what treatment options are available. Okay, correct timing of the medications. So when they are taking the metformin, so preferably after the food, because they cause a lot of the gastritis, etc. Suppose you are prescribing the glimepirides, which stimulates the pancreas to release more and more insulin, preferably before the food intake. You are giving the Oclipose before the food. When you are giving the basal insulins, mostly at the bedtime. When you are giving the Actrapid or the Insultat, etc., preferably half an hour before the lunch or before the breakfast. When you are giving the Lantus or when you are giving the Fiasp, just 5 minutes before the food. So these are all the timings, how they act, what is the duration between the food and the drugs. You should know that, and correct timing of the medications is very important. One fellow, my own patient, she is getting the Mixtard morning 25 units half an hour after the food. I told her to take the injection half an hour before the food. Okay, Mixtard. So that is in the polymeric form, insulin. So that has to be converted to the monomerics. That is the most active form. So it takes minimum 30 to 40 minutes. So if she gets the injection half an hour to 45 minutes before the food, by the time she takes the food, already the insulin is in the active form. So that will reduce the postprandial hyperglycemia. So is taking half an hour after the food. What happens immediately after the food? The blood sugars will go up. So this insulin, half an hour after the food, she is getting it, and it has to be act as active form in another half an hour to 1 hour. So by the time the blood sugars are 350 or 400. Okay, so we should anticipate. We should not be reactive. We should be proactive. So a lot of the difference. So then I told you why, in spite of the insulin, why the blood sugars are not coming down. Then I asked the leading question: when you are getting the injection, as you are saying that you said that to take half an hour after the food, not after the food, Baba, before the food. See the simple, but the blood sugars are very high. Luckily, she didn't get any complication. So sometimes now 400, 500, if she gets acute myocardial infarction, so whom to blame? So it's very, very important. So don't underestimate the importance of your medical education in any diabetic individuals. These are all part and parcel of the medical education. Treatment of the other associated problems like blood pressure and lipids. So in a diabetic individual, don't concentrate only on the diabetes only. Diabetes means A, B, C, D. A means A1C, that is your diabetes. B means blood pressure. C means cholesterol. D means your diet, your drugs, and your doctor and patient relations. These are all important for the D. and E stands for your exercise. Okay, so then only you can have a very good control in all the diabetic individuals. So this is important. So don't underestimate the importance of the diet, exercise, foot care, eye care, etc., kidney care, or your heart care. So these are all very important. So these are all the components of the diabetic education. Information regarding the complications, when and how to screen for the complications, what to do if the complications develop. Don't be hurry, don't worry. See, sorry saying that that fellow is having the breathlessness and got the ECG done, got the echo done, and then thought that it could be an acute myocardial infarction. Immediately they refer for the angio and the triple vessel disease. They put 1 or 2 stents, and then now she is alive. So that's what happened when you identify the complications much early and act accordingly. Okay, so that is what to do if the complications develop. Still, we can save the patients. Prevention, recognition, and treatment of the hypoglycemia. So this hypoglycemia is very, very important. It's almost like a major killer for all the diabetic individuals, especially diabetics on insulin therapy. Okay, and advice regarding the tobacco and alcohol is no tobacco in any form, whether it's BD, cigarette, or cigar, or gutka, or Vimal brand, or something other brand, whether it's Salman Khan or Shah Rukh Khan, etc., etc. No. In the same thing to the alcohol also. Advice regarding the foot care is a very, very important. Foot in diabetics is much more important than the face. So foot care is very important. And the amputation means in India, two reasons. One is traumatic amputation. The second one is diabetic amputation. Diabetic amputation is also. Okay. Then we have the where is the role. If that is true, so our role is very high in educating the foot care in our diabetic individuals. So monitoring the diabetes, treatment targets, you keep you the targets. So an elderly individual living alone, living in the old age homes, or living alone in the top floor, so keep the HbA1c at 8.5. Fasting blood sugar 150, don't worry. For post-1 blood sugar 250, don't worry. If you keep the fasting at 110 or 120, then suddenly the blood sugar will come down to 60 or 70 and he will be in the deep coma. Okay, so targets differs from the person to the person, individualized. Importance of the regular follow-up, this is very, very important. At least once in a month, or once in 2 months, or once in 3 months. So for most of my patients, I ask them to come once in 3 months. Some people I ask them to come once in a month or once in 2 months. So this is very important. How to do self-monitoring the blood glucose, SMBG, for the pre diabetics, for the LADA, pregnancy, post-transplantation. So these people, so immediately they have to buy the glucometer and one book and keep the blood sugars as and when required. Importance of screening for the complications. So special situations, the travel. So going to the US, going to the Australia, going to the New Zealand, most of our diabetic individuals. So what to do when they are in insulin therapy. So that is also very important. Fasting. So whether you like it or not, so most of our people, they are on the fast. Now all the Muslims are on Ramjan fast for 1 month. In the same way, Ashada Masam, lot of the days are there for the Indian, for Hindu population. So we have to respect their sentiments. And according, yeah. So we have to respect their sentiments and we have to act accordingly. So we don't prescribe the sulfurious in such fasting days because we can invite the hypoglycemia. In such population, better to avoid the hypoglycemic agents and give anti-hyperglycemic agents. Sick days. So when the fellow gets the fever, etc., what to do? Counseling regarding the marriage and the childbearing. So if it is a type 1 diabetes, wants to get married. So after marriage, again wants to conceive. So again, we have to check the retina. If there is any non-proliferative diabetic retinopathy, okay, proliferative, go for the laser first before the pregnancy. In the same way, check the urine protein. When there is proteinuria, don't go for the pregnancy. So first treat the proteinuria, reduce the proteinuria, then go for the pregnancy. So in the same way, when the HbA1c is 8.5 or the 9 in a type 1 diabetics, so don't conceive. So first go for the insulin, intensive insulin therapy, reduce the HbA1c to about 6 or 5.7, then plan for the surgery, plan for the pregnancy. So these are very important, especially in the females nowadays because of the Sri Chaitanya Narayana schools. A lot of the people are diabetics, childhood diabetes. And because a lot of the stress and a lot of the viral infections, this virus directly attacking the beta cells, causing the beta cell fatigue and beta cell infections and inflammation, apoptosis, leading to the type 1 diabetes. Now in the society, type 2 diabetes is increasing and also occurring at an younger age group. And the second thing is type 1 diabetes is also occurring in a big way because of the viral infections directly to your pancreas. So definitely we have to respect their marriage and the childbearing and the pregnancy, lactation. So these are very important. So lifestyle changes also. So when the fellow is on the ACE inhibitors or ARBs, so avoid them before the pregnancy because they are contraindicated during the pregnancy. In the same way, when the fellows are on the diuretics, again avoid them. So these are all preconceptional counseling is always important for most of our population. So SMBG already told you the benefits are very good. Who should be do the SMBG? All the type 1 diabetes, brittle diabetes, type 2 diabetes and multiple daily doses of insulin. So definitely you need it. Pregnancy and insulin pump therapy or post transplantation or post CABG at least for 2 months or 3 months. So this is the glucometer and then the glucose strips. So this is how they put a log book. So Monday fasting, what is the value? And the Tuesday, other times, etc. You can get it done. So this is a omission, perform, data obtained. So you can know that conclusion. XMBG is very useful in the management of both type 1 and the type 2 diabetes. See, this is the very important for all of us because we should know the high risk individuals in the society. Screening for type 2 diabetes. See, this is, as I told you, diabetes is a progressive and a dynamic disease. See what happens to the pre-diabetic individuals. You can reverse back to the normal glycemia. See what happens to the clinical diabetes. Again, even though the sugars are very high to diagnose the diabetes, with your MNT, you can come back to your pre-diabetics and then pre-diabetics, the normal population. So they are there, about 2 to 3% of our population of the type 2 diabetes, that the reversal of the diabetes is possible. Reversal of the diabetes. So it is possible, that is reversal of the diabetes. So that reversal of the diabetes is possible with your good medical nutrition therapy. On the other hand, some fellows are there. Last year, random blood sugar 168. Today, random blood sugar 300. So within 1 year, the 160 to 300. So at 160, he didn't notice that he is in a pre-diabetic condition. Now he is a diabetic. So had you given the advice at that juncture 1 year ago, saying that you are a pre-diabetic and you are going to be a diabetic, probably you might have taken some steps about your medical nutrition therapy or exercise, etc. And this diabetes can be postponed. So that is the thing. See, yeah. See, all the complications are directly proportional to two things. One is duration of the diabetes. The second one is control of the diabetes. If you postpone the diabetes, and obviously you are postponing the complications also, because the duration of the diabetes is reducing. Criteria for testing for the diabetes in asymptomatic undiagnosed individuals. All first degree relatives with the diabetes. Okay. See, whenever a diabetic fellow admitted in my hospital in the room, so whether his brother or a sister, everyone will be checked blood sugar once, free of cost. See, whenever I for the morning rounds, I go there, and sister will be there, or brother will be there along with that patient. So then I ask a leading question, who is he? So then I asked them, are you a diabetic? No, doctor. Ask the sister to check the blood sugar immediately. So most of the times, no, the blood sugar will be 180, 190, sometimes 200, 250, etc. So the first time we are diagnosing the diabetes in their first degree relatives, brothers or the sisters, and first time we are diagnosing them as the pre-diabetics. Once they are the pre-diabetics, I will hand over to my sister. Say, tell the sister about your dietary approach, your exercise, etc., etc. Suppose if you are diabetic, first time diabetic, diagnosed this, then get the postprandial, get the fasting, get the HbA1c, get the lipid profile, and then act accordingly. So that is how you have to see that the first degree relatives are diabetics or not. Then the high risk are races. So we are at high risk of getting. So even though without any family history, we are more prone for the diabetes because of our Asian origin or Indian origin. History of the CVD. So when the fellow is having history of heart problems or the neurological problems, etc., vascular diseases, so he is at risk of getting the diabetes. Hypertension. So today's hypertension, tomorrow diabetics. Today's diabetics, tomorrow hypertension, and day after tomorrow both diabetes and hypertension. So all hypertension should be screened for the diabetes, and all diabetes should be screened for the hypertension. And of course, cholesterol also. Same thing opens to your cholesterol also. Open with the polycystic ovary disease, PCOD. So PCOD is again a pre-diabetic condition. So all the PCOD population should be screened for the diabetes. Physical inactivity itself is a big risk factor. So all doctors are physically inactive, they are all more prone for type 2 diabetes. Other clinical conditions are the insulin resistance like skin tags, acanthosis nigricans, definitely have to go for the examinations. So how to cost effectively screen for the diabetes? This is a very good. This is Indian Diabetes Risk Score, IDRS. A simple 2-minute Indian diabetes risk based on the 4 simple questions. So within 5 minutes, you all know that how many of you are diabetics or not, or is there any risk of getting the diabetes. So just 2-minute risk, 4 questions. What is your age? So ask yourself, what is your age? You know your age. Then second question, do you have a family history of the diabetes? So ask yourself whether your mother is a diabetic, father is a diabetic, or first relative is a diabetic. If yes, does your father or mother or both have the diabetes? Okay, now you got the 2 answers, your age and your family history. Now, do you exercise regularly? So obviously no. So that is the right answer. So that answer I tell you. That is the third question. Okay. Now, how physically demanding is your work, occupation? So sedentary. Okay. Then, in addition, a waist measurement using an inch tape. You know your waist circumference. So for all the males, we know our fan sizes: 34 inches, 36 inches, or 40 inches, etc. So waist circumference more than 19 males, more than 80. That means more than 36, more than 32 is dangerous. So now you know the waist circumference also. So now imagine how many factors are there, risk factors. So this is the score. Now put it in this score. Age less than 35 years, 0. 35 to 50 years, 20. More than 50 years, 30. So within 2 minutes, I have to. You all should show me your score. Okay. So yes, keep your score there on the book. According to this age, score according to your age. Some people they put 0 because if you are less than 35 years. So some people you put 20 because you are between 20, 35 and the 50. And some people they put 30, more than 50 years in age group. Okay. So the first is over. Next, waist circumference. Okay. That also you know. Less than 80 centimeters in the females, less than 90 in the males, 0. Suppose 80 to 89 in the females and 90 to 99 in the males, you put 10. More than 90 centimeters in the females, more than 100 centimeters in the males, 20. So this fellow, anesthesia just passed. So you put 20 na? Huh? 10 na? What is your waist circumference? Huh? 39. So 39 is 10. Okay, 10. So almost 40 now. Right. 10 the physical activity. So vigorous or regular activity 0. No 0 to us. Mild to moderate regular exercise and moderate physical activity at home or the work 20. No exercise, sedentary at home and the work is 30. So some people put 20, postgraduates, consultants to put 30. Okay, you got the points. Now the family history. No family history 0. Either parent 10, both parents 20. Now, okay, nu chapra నీతో start చేయి. What is your score? 30. Okay. So 30 is it low risk or moderate risk? Mild లేదు ఇక్కడ. Moderate risk. Moderate risk. Okay. So what is your score, sir? Pidiguralla? 70. 70 score is 70 because very high risk. Okay. What is your score, Krishnamohan? 40. Okay. So 40. That is moderate risk. What is your score? 60. See, very high risk. Even though you are not a diabetic. See, that's what I am saying that. Even though you are not a diabetic, but you are at high risk of getting the diabetes with this score. So we can't stop our age. That is not in our hands. First point is not in our hands. But waist circumference is in our hand. Okay. So we have to reduce the waist circumference. Physical activity is in our hand. Again, the family history is also not in our hand. Yeah. So we can't change our parents. So the parents and the yes. So that is not in our hands. But we have to reduce the waist circumference and good physical activity. That is physical. That is very important. Okay. So this is the Indian diabetic risk score. Okay. See, her score is 70. See, imagine. So even though we are not a diabetic by this juncture, but we are at the high risk of getting the. That is the beauty of this class. So everyone is at a potential candidate to get the diabetes in India. Every candidate is at a potential candidate to get the diabetes in India according to this score. Suppose your age is more than 50 years, both the parents are the diabetics. Even though your waist circumference is normal, even though your physical activity is very high, so 30 plus 20, what is 50? 50 means already moderate. So without your involvement, already 50 is there. So obviously your waist circumference is more or no physical activity, and somewhere 70, 80, 90 is also there. So from tomorrow onwards, so please don't change your parents or your age. It is not your hands, but definitely waist circumference and physical activity. These two are in our hands. So to reduce from your risk. Okay. So here Mrs. B, 32-year-old homemaker. Her waist circumference is 92. She does moderate physical activity at home. Her father has diabetes. What is their IDRS? What is the risk of developing the diabetes? Is there any risk for her? Yes, because father diabetic and then waist circumference 92 and moderate physical activity risk, even though the age is 32. So most of our family members are like this. Okay, most of you also like this. Age may be 30, around 30. Waist circumference is more, no physical activity, and father family history. So the risk of developing the diabetes is very, very high. The same thing happens to all these people. Prevention. How best can diabetes prevention be achieved? Dietary modification, physical activity, some drugs like metformin or SGLT inhibitors, etc. A combination of all these things. So these are all the preventive programs. See here, very important slide, this one. You see metformin reduction, how much? First one, 31% reduction, risk reduction in the diabetes. And then lifestyle changes, how much? See, that is the beauty of the lifestyle changes. So with the lifestyle changes, 58% reduction prevention in diabetes when compared to the metformin. So don't think that we can reduce the diabetes with the drugs. So with the lifestyle measures only, we can able to reduce the diabetes much better. See the same thing here. So diabetes prevention program in two things, one in America, one in India. So metformin, the risk of diabetes is reduced by 31%, whereas lifestyle changes nearly 60%, double the reduction. See, lifestyle modification found to be more effective than the metformin. Modest weight loss, just 5 to 10% of your body weight. Modest physical activity, 30 minutes per day. From tomorrow onwards, so improve a modest physical activity. Just start with the 30 minutes a day, and then weight loss. Aim for about just 5 to 10% of your weight. Suppose you are 70 kgs, just aim for 3.5 kgs. That is 5%. 10% means 7 kgs. That is possible with your restricted calorie intake. Don't avoid anything. Don't stop anything. Whatever you like, take it, but in a restricted manner. So that is my motto. I always tell my patients, if you are interested in kaja, take it. If you are interested in the jalebi, you take it. But restrict the amount and then go for the meal exchange. So take the guava or take anything else, but reduce the rice content today, carbohydrate. So at the end of the day, calories should match. So you are supposed to take about 1400 calories or 1600 calories. You are taking 2 kajas today. So that is about 400 calories. So restrict your dietary amount. That is called meal exchange. So all the diabetics, so simply they should not give any punishment not to eat this thing, that thing, this thing. Yeah, they are at liberty to take anything, but provided finally at the end of the day, calorie consumption should be restricted. That is most important. So with this, I think we'll stop. Lifestyle modification advantages: they're safe, they're effective, inexpensive. It can be advised for almost anyone. Has additional benefits on lipids, blood pressure, CV health, etc. So in conclusion, type 2 diabetes is a preventable one. Do you agree with me? Is it a preventable one? Yes, because reversal of the diabetes is also possible. Detect individuals IGT and IFG and the direct prevention strategies to them. Okay. Lifestyle modification is the key to prevent the diabetes. Drugs may have a role in some cases, like in metformin, etc. Even after the diabetes develops, good control of your glucose, lipids, and BP can prevent the complications. That's what we want from. That's what I want from all of you. So, thank you very much for your patience here.